Well, I've listened last night to the president's address with great interest, and he was, I think, right in pointing out we spend more money for health care in America than any other country by far. We don't get better results. We have about 14,000 people in this country that are going to lose their health insurance today. We've got 47 million Americans who don't have any health care coverage at all. And what the president said yesterday is while we try to extend coverage to a lot of folks who need that coverage, we're going to do that by probably 2/3 of the cost of doing that will come from savings. He probably went to a place today called Cleveland Clinic up in Cleveland, Ohio, and it's Cleveland Clinic is a lot like a place called Geisinger in Hershey, Pennsylvania. It's a lot like Mayo Clinic in Minnesota and Florida, a lot like Intermountain Health in Utah, a lot like Kaiser Permanente in Northern California, a lot like Puget Sound up in Washington State. What they've done, they figured out how to provide better healthcare outcomes at lower cost. And it's what they've done is gotten rid of the fee-for-service conundrum where you just do more visits, more procedures, more tests, more MRIs, more X-rays, sometimes not for a very good purpose. And all those non-profit clinics around the country, big operations, one of the things that they do is they focus on primary health care. They focus on coordinating care. That's focused on the patient, not on how do we make the patient better, not necessarily how do we reward the doctors, hospitals, and nurses. They make sure that all their patients have electronic health records, which help save lives, save money, save costs, provide better outcomes. They focus on managing chronic diseases. About 75-80% of the cost of chronic diseases can be attributed to 4 factors. They include diet, exercise, obesity, smoking. And one of the things that these, like Cleveland Clinic, where the president is today, they've done a very good job of going after managing chronic diseases. So those are some lessons that we can take and need to take to here in the Senate as we craft our legislation. We'll pass healthcare legislation, not just in my lifetime, I think in this year. And I know some people are saying we're going too slow, what's taking so long? It's probably the toughest thing that we'll try to do during the time that I have served or likely to serve in the United States Senate. It affects most directly 1/6 of our GDP, and there are Democrat-Republican ideas, and some of our Republican friends are determined to make sure we don't pass a legislation, and some Democrats that are insisting on their things that they have to have. So it's just hard to get 60 votes to get anything done. I think in the end, though, what the president said in his address last night, I especially agreed with. He said, number one, I'm not going to sign legislation, this is the president talking, I'm not going to sign legislation that increases the budget deficit. We're going to pay for this. Second, he said that I'm not going to sign legislation that doesn't reduce the growth, rein in the growth of healthcare costs in this country. The idea that healthcare costs are growing at 2 to 3 times the rate of inflation, and for that to continue, that's just unacceptable, because eventually we'll run out of money. And even if we do extend healthcare coverage to the uninsured right now, we're not going to be able to sustain that in the long haul.